My name is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. Today, our webinar is hosted or sponsored by the Hiring Employees Resource Package. You can have access to the Hiring Employees Resource Package with templates that you can use right away to help you to recruit, interview, orientate, and even conduct performance appraisals in your organization. The Practice Management Hiring Employees Resource Package includes podcast interviews from experts to help you in each of those stages. Today, our Practice Management Nugget webinar is on preventing big fines or worse for your healthcare practice. Learn how to plan a privacy impact assessment. Today, we're going to talk about planning a privacy impact assessment. A PIA should be as commonplace to a healthcare practice as a business plan is to a business. But most healthcare practices don't know this and often don't know that a PIA is usually part of their professional college requirements and often even a legislated requirement. Prevent malicious errors, omissions, or attacks that could result in fines and even in jail time for the business, healthcare provider, employee, or the vendor by completing a privacy impact assessment. This webinar is for you if you are a healthcare provider, practice manager, or vendor that supports a healthcare provider in a group or solo practice with direct patient care. Today, you're going to discover the biggest mistakes that healthcare business owners make that can cost them thousands of dollars per year, and more importantly, how you can avoid them. This webinar will give you an insider's PIA tips for privacy officers, practice managers, and healthcare providers and practice managers. Not taking the time now to develop consistent policies and procedures that support your privacy impact assessment and training about the collection, use, and disclosure of health and personal information will have an impact on your practice. As we go through the webinar today, I'm going to use some general terms and specific to healthcare practices in Alberta. Now, with a few exceptions in terms and terminology, the key concepts apply to most other Canadian provinces and also meet most of the HIPAA requirements. If you have additional questions about how these concepts apply to your organization, please enter them into the chat box. So depending on which platform that you've joined us on, the Easy Webinar or on the YouTube or Google Hangout, you can enter your questions in the chat box and we'll try to answer those questions as we go through. If I've run out of time and we haven't answered your questions during the webinar, please send me an email and I'll be happy to send you a reply to your question that way. So what exactly is a privacy impact assessment? The privacy impact assessment is definitely a process. There are many steps to put these things into place, and many of them are iterative steps. It means that we go a little bit down the road, then we need to go back and answer some additional questions because we found additional information. So you're going to go back in this process many different times. It's a process that assists custodians or healthcare providers to review the impact that an implementation of a new administrative practice, information system, or change to an existing practice or systems relating to the collection, use, and disclosure of individually identifying health information may have on individual privacy. Now, throughout the webinar, we're going to speak specifically about health information, but it's very important that you remember that employee information and other sensitive information in your practice, like billing or business information, is also something that you need to make sure that you've got the correct policies, procedures, and training in place. So when we speak about health information, remember too that it needs to include all of those other types of sensitive and individually identifying information. The PIA process describes the information flows in the project, identifies the legal authorities that allow for the flow of that information, and assesses the potential impacts and the risks to privacy, and identifies those mitigation strategies to minimize those risks. The process is designed to ensure that custodians evaluate the new practice or proposed change to ensure technical compliance with the Health Information Act, as well as assessing the broader privacy implications for individuals. Often, the privacy officer completes the privacy impact assessment. However, the custodian, the owner, or the CEO of the organization is responsible for making sure that that PIA is completed. Privacy principles and legal authority determines your compliance obligations. Now, the PIA process includes many steps, but generally, you need to start with your sound foundation in your organization. You need to make sure that you have good policies and procedures about health information. Now, oftentimes when I visit a clinic, they have many operational policies and procedures in place about how to answer the phone, how to manage your staff, and how to manage cash in the organization, and perhaps doing sterilization procedures. But your policies and procedures for your privacy impact assessment also need to address the information about how you are collecting, using, and disclosing personal information. So make sure that your policies and procedures cover this broad scope of information. And we're going to talk about that a bit more in the webinar. All of those policies and procedures become the foundation for your privacy impact assessment. In some jurisdictions, there is a particular format or forms that you may need to use to submit your privacy impact assessment to the regulator. But remember that a privacy impact assessment is something that you first internally want to do for your organization, and make sure that those individuals that are responsible for that business practice have signed off and reviewed and accepted that privacy impact assessment. In Alberta and in many provinces in Canada, we have the Office of the Information and Privacy Commissioner, which is kind of like an ombudsman. They are not an agent of the they are not a private corporation. They are not a member of the government. They are an agent of the Legislative Assembly. And that does change a little bit from province to province. But generally, they are an independent third-party body who is going to review your privacy impact assessment to make sure that it's met the obligations of your legal authority in your jurisdiction. The OIPC will review the privacy impact assessment and provide comments to the custodian or the individuals that have submitted that privacy impact assessment. Now, this is a process that you need to do every time that you have made changes to your organization or you've added additional stakeholders that impacts the information sharing in your organization. There are many purposes of the privacy impact assessment, but it is essential to have these things in place to protect the personal health information of individuals. So if you have clients or patients coming to your organization, you need to make sure that you have the privacy impact assessment and all of those steps in place to protect that personal information. You're going to consider this for every time that you collect, use, and disclose or share personal information. And you're also going to make sure that your policies and procedures include those key steps about retention and storage of information. The privacy impact assessment should also address how you're going to ensure access for the individual or the patient to have access to their information. There are many advantages of doing a privacy impact assessment. Many times we think that we have things implemented and in place and working, and it's only when you go through and review your policies and procedures and do your risk assessment that you realize that things don't work the way that you had thought. For example, Many times we go through and do the privacy impact assessment and find out that the backup that you've been relying on wasn't working the way that you had planned. We find that people are using the system the way that it was not intended. For example, a transcriptionist was using the same computer at her home-based office as her kids and was subject to the privacy breach from the Sony PlayStation. Employees sending work home but using their husband's email account and subsequently having more people having access to information than was intended. A vendor making a backup of the physician's billing files along with all the other clients in one file folder and could not restore the information for that particular physician client without reviewing all of the files from multiple clients. So your privacy impact assessment is going to be very robust. It's going to include information from all of the stakeholders so that you don't have unpleasant or nasty surprises when you need to go back and review information that you thought was protected. A privacy impact assessment is a key part about sharing information with stakeholders to make sure that everybody clearly understands how the information is going to be collected, used, and disclosed. Having a privacy impact assessment and that communication piece with the stakeholders will help you to prevent messy separations from within your group practices. Make sure that you have proper information management agreements and business vendor contracts to make sure that you don't have your information being held hostage or not having access to information that you had planned or anticipated. It will help you not having a privacy impact assessment in place. You are going to find that you might have missing policies and procedures, that you might have gaps in administrative, technical, or physical safeguards. So these issues are scary, and the solution requires having a plan. And that plan is having a privacy impact assessment. So a privacy impact assessment will help you with that documentation process to meet the healthcare provider's standards of practice and regulatory compliance. It will help you to select the best vendors and solutions for your practice. It's very important to clearly document your procedures. In many practices, we have good things that we do in our practice, but we don't always have them in writing. A privacy impact assessment will help you to make sure that you do have good policies and procedures and that you have them well documented in writing so that you can continue to train your staff and have things implemented in a consistent fashion. The privacy impact assessment process takes time, but it will help you to facilitate discussions with stakeholders to develop a clear understanding of expectations of group practices, employees, and vendors. What triggers a privacy impact assessment? When do you need to do a privacy impact assessment? Well, if you're starting a new practice, you need a privacy impact assessment. If you've got a new information flow or changes in or significant changes in technology, or perhaps when there's changes in legislation. Sometimes you may have identified new risks to health information. Our technology changes on a regular basis. And when you hear about a privacy breach that happens to the other guy and you think about your practice, you may identify a risk that you didn't appreciate before. So you may identify new risks to the privacy of health information. So we need to make sure that we understand and review and periodically review our policies and procedures. Things change, particularly when it happens with technology or you have a change in staff. So being able to review your privacy impact assessment on a regular basis, and that means annually or perhaps once every 2 years, and go through and review and document your policies and procedures, your information flow, and your risk mitigation strategies. These are all key triggers for a privacy impact assessment. If you have already completed a privacy impact assessment, say 5 years ago, and you find now that you've reviewed your privacy impact assessment and you need to do an amendment, it is possible that you don't have to do an entirely new privacy impact assessment. You may be able to do an amendment, and that means addressing what you had in your initial initial privacy impact assessment, and then what has changed. And then just address what has changed. So if you've changed a part of the technology, you haven't changed all of your technology system, then you might be able to do an amendment just on that change in that technology. If you've added a new site or a new location, but things generally are done in the same way as the initial or original location, an amendment that addresses those changes between the different sites might be sufficient. If those amendments are small enough, you might be able to address it in a cover letter, a 2 or 3 page letter that addresses those amendments. If you're adding a new practice or a new project in your organization, or you're adding on an additional level of technology, for example, having patients registering on the portal when they come into the clinic, but you haven't changed significantly to the rest of your practice, you might be able to address that as an amendment as well. So you probably have your privacy impact assessment, which is organizational wide. That's the big privacy impact assessment. Some organizations may have more than one privacy impact assessment. You might have project-specific privacy impact assessments. So if you're a large organization, you may have many privacy impact assessments. So let's assume that you're getting started with your brand new first clinic or your new practice. And the very first step that you're going to do in your privacy impact assessment is to develop your project description. In your project description, you're going to identify the stakeholders in your organization. You're going to describe the organization, and that means the business contact of that organization. Is it a sole proprietorship? Is it a professional corporation? Where was it incorporated? Under which province? Under which legislation? And who are the key players in that organization? You're going to also identify those key stakeholders or vendors in your organization. So your project description should answer those 5 W's and an H. What is your project? Who does it include? When are you going to implement? What does the project do? What is the purpose of your project? And what is the scope of the project? What other stakeholders are you going to share information with? What other stakeholders or vendors are going to support you in being able to complete that privacy impact or that project? The project description is a key part about your privacy impact assessment. And this is also the very key place to get started with your privacy impact assessment, by including all of those players in your organization to come to a consensus about your project description. You need to have your project description concise enough that everybody can review it and say, yes, that sounds like what we're going to do. If you have gaps in your project description, if you know that you're going to start a practice, but you don't know when that's going to be, you haven't identified the location that you're going to open in, you haven't identified the key vendors with that organization. For example, if you're going to implement an electronic medical record and you know you want to do that, but you haven't signed a contract yet or made a selection about which vendor you're going to use, you're probably a little too early in that PIA process. You need to have those key details in place to really have a good handle about completing a privacy impact assessment. But you can certainly start the process now and fill in the gaps as we go through the details. So the first part in your privacy impact assessment is that project description. Make sure that it's complete enough that all of your stakeholders, your staff, your owners, and your vendors can sign off on that project description and make sure that you have a clear understanding about what the project is. The next step is to determine your policies and procedures. So in your policies and procedures, you're going to need to make sure you've got those operational policies and procedures about how you're going to open the clinic, how you're going to hire the staff, but you also need that policy and procedure set that's very particular about how you're going to collect, use, and disclose personal health information in your organization. It needs to be specific to the legislation that you must comply with. So in Alberta, that would be the Health Information Act. If you are operating a private practice, you will need to refer to the Health Information Act. If you are operating an organization that is funded by municipal government or provincial government or federal government, you might also need to consider the FOIP legislation or PIA legislation. Most provinces in Canada now have specific legislation to the Health Information Act, and that takes precedence over other legislation. So while we're going to focus on Health Information Act legislation, remember too that you may need to include references to other legislation about how you manage employee information, your business information, and even your occupational health and safety information. So in your policies and procedures, I strongly recommend that you develop a format for your policies and procedures that includes a uniquely identifying a policy about, for example, how you're going to collect patient information. On each written policy and procedure, you're going to have a unique title, and you're going to have some key information about that policy procedure, which includes the start date, the review date, who it's been authorized by, and perhaps even the policy or procedure number. Doing that makes it very easy to be able to refer to in your privacy impact assessment. So your policies and procedures becomes the foundation for your privacy impact assessment. And if you have them in separate documents and you have those policies and procedures numbered, it makes it much easier to say, yes, we comply with this part of the legislation, see policy number 2 as a reference. If you have all of your policies and procedures jammed together in one great big long document, it makes it really hard to cross-reference. So your policies and procedures, make sure you've got a good format for your organization and you have those key pieces in place. The next step about doing a privacy impact assessment is you're going to take a look at the personal health information flow. The information flow is not an information technology architecture diagram. It's not even a workflow diagram about who's going to be the different handoffs and who's going to do which pieces of the work. But you do need to think about information as being a package. And how is that package of information being transferred within to your organization and outside of your organization? So every time that there is a handoff in your organization or with another stakeholder about how you're going to collect, use, and disclose information, how you're going to moderate or control how people can view, read, modify, or delete information, should be those key points that you're going to include in an information flow. So an information flow diagram, there are many ways of being able to do this, and we do teach a course about doing a privacy impact assessment, and we'll get into greater details about how the many different samples of doing an information flow diagram. So at this point, what you need to know is that you need to identify all of those handoffs for the information. If the patients are providing you information, that's one step of the information flow. If you are providing the information that a patient has provided you, and you are now giving it to somebody else, maybe it's a lab, maybe it's an X-ray facility, maybe it's another healthcare provider in another organization, or some other care individual or third-party individual, you need to identify all of those steps, all those handoffs in that information flow diagram. Now, every time that you hand off information and you collect information, you need to do step 4 in that privacy impact assessment, which is the risk analysis. You need to identify how you're going to keep that information safe and secure when it's in transit, when it's at rest, and how you're going to keep that information safe and secure during the entire retention period. So that risk analysis is going to take a look at each step where that information is. So you're going to go back to your information flow diagram and say, when we collect the information from the patient, this is the risk to how we're going to privacy, confidentiality, and security of that information. For example, a patient provides you their personally identifying information because they filled out a paper form in your organization. They bring the paper form to you and you enter it into a computer system. How is that information on the paper going to be kept secure so somebody else doesn't read it by mistake? How are you going to protect that information so that somebody who is an authorized person in your organization doesn't misuse that information incorrectly, so that you don't make a mistake? And also, how are you going to prevent that information from being used maliciously? So perhaps you've collected all of the information from the patients and you've now put those pieces of paper in a pile. Is that information kept in a secure shredding box that nobody else would have access to? Or perhaps when the receptionist is going back to the back of the clinic, somebody from the waiting room couldn't grab those paper information and maliciously use that information, that unauthorized access, for identity theft purposes. So you're going to take a look for your risk analysis for each of those handoffs in your information flow and make sure that you've addressed the privacy, confidentiality, and security of information. You're going to take a look at it from a point of view of safeguards. So physical, administrative, and technical safeguards. And in the course that we teach for doing a privacy impact assessment, we'll give you lots of examples about those different safeguards. You can also follow the examples, and many of the articles that we have on the website for informationmanagers.ca will give you more details about those safeguards. Now that we've got another piece to our puzzle, the next step, 5 in our privacy impact assessment, is determining the legal authority. So for every time that you collect, use, or disclose information, you need to go back to the legislative authority that allows you to do that. So if you're going to collect information from a patient to provide a service, you need to have a legal authority that allows you to collect it. For example, in Alberta, only custodians under the Act are allowed or authorized to ask a patient to provide them the Alberta healthcare number. If you are applying for a library card or a loyalty card with a store and they ask you for the healthcare insurance plan number, they do not have that legal authority to collect it. A healthcare provider that works under the Health Information Act does have legal authority to collect your healthcare information. So you need to determine in your privacy impact assessment as step 5, what specifically is your legal authority to collect, use, or disclose the information for each of those steps in your information flow diagram. So you can see in the 5 different steps in a privacy impact assessment that it continues to build on your policies and procedures and each of the different steps in your PIA. So you need to be able to go to the legislation and cite the very specific section or of the Act that allows you to collect, use, and disclose that information. So we've talked about the 5 steps in doing a privacy impact assessment. The very first step is the project description. Make sure that you have all of your stakeholders involved in that project description so that you can share that common understanding. Your policies and procedures is step 2. You're going to get started with a basic foundation of policies and procedures, and this is going to be the foundation for your privacy impact assessment. Step 3 is the personal health information flow. How are you going to collect, use, and disclose personal health information? Who are you going to share that information with? What type of technology is going to support you in doing those things? That's what you need to include in your personal health information flow. Step 4 for a privacy impact assessment is the risk analysis. How are you going to make sure that you've protected the privacy, confidentiality, and security of information for each step in the health information flow? And then step 5 is, what is your legal authority to do that? You need to make sure that you have met the regulatory compliance in your industry and in your location to make sure that you are meeting the legislative requirements. And I'm going to pause in a moment to answer your questions in the chat. So if you'd like to answer those questions in the chat, we'll try to get through your questions just as quickly as we can here. So the privacy impact assessment includes those 5 steps. When you have a privacy impact assessment, it's going to assist you. Privacy impact will help you to improve your healthcare business policies, procedures, vendor management, workflow, and will help you to protect privacy, confidentiality, and security of personal health information. That privacy impact assessment, those 5 key steps, provides a comprehensive review for your organization and will help you be able to ensure the privacy, confidentiality, and security of the information and improve your business practices. So, a couple of key reminders about the privacy impact assessment process. Make sure that you include your stakeholders. You need to clearly identify who those folks are. Review or develop the information flow, your policies and procedures. Spend time on reviewing the implementation and the mitigation plans for identified risks. You're going to identify the safeguards for administrative, technical, and physical safeguards to protect those areas of information. You need to make sure that you're meeting legislative requirements, and that means that you actually get a copy of the Act and you learn how to read it and you learn how to apply that information. When you have all of those pieces together, you're going to put the privacy impact assessment together in that written document that's required for your jurisdiction. Make sure that your organization has reviewed it and signed off on it. So that includes the key healthcare providers in your organization, your owners for that organization. Depending on your location where you are and the regulatory compliance rules, you might need to submit it to an external regulator, like the Office of the Information and Privacy Commissioner. You might need to share or demonstrate your privacy impact assessment with other stakeholders that you want to be able to share information with. We want to make sure that the people that you are sharing your patient's health information with understand your policies and procedures and expectations, and make sure that your vendors understand that and are prepared to be able to meet those key important considerations that you feel are important for your organization and that you've met those legislative requirements. We want to make sure that everybody that's coming to play in that sandbox and is going to have access to patient personal identifying health information know the rules and follow those best practices. When you have these key points in place, as a business, you've met your obligations and your responsibilities to make sure that you've met those minimum requirements. Now, unfortunately, we have many privacy breaches in healthcare, and 80% of all of our privacy breaches are actually within the organization. Now, many of those privacy breaches are oopses. They are mistakes, things that happened that shouldn't have happened, but were not malicious. We didn't plan to go out and hurt somebody. We made a mistake and we sent a fax to one doctor's office when it should have gone to the other doctor's office. Each of those privacy breaches are important, and your policies and your procedures and your training should help to limit that amount of privacy breaches and will help you to prevent malicious privacy breaches. From time to time, we do have employees or vendors or outside people who hack into your systems who are maliciously going to access information and use it for the wrong purposes. If you have done a good job about determining the foundation of your policies and procedures, you've identified the risks and mitigated those risks in a reasonable fashion, you as a business have taken the appropriate steps to help protect that information. I can't promise you that doing a privacy impact assessment is going to give you a Superman coating over your practice and you'll never have a bad incident or a privacy breach. But if you've kept these steps in place and you've reviewed them on a regular basis, it's going to be a reasonable expectation that you've done a good job about anticipating those risks and trying to prevent them. A privacy impact assessment is a good way to be able to demonstrate to your staff, to your patients, and to your vendors and stakeholders that you think that privacy is important. You're going to meet your regulatory compliance requirements and that you're going to take those key steps to make sure that you're doing the best that you can. And that becomes a very big part about how you manage your business and do your branding in your organization. And to help you with doing your privacy impact assessment, we do have a new course that's being offered in January about doing a privacy impact assessment. Protect your practice, your assets, your patients with privacy impact assessments, a complete step-by-step course. So we're going to enter the information in the chat box about how you can access that information. And you can go to our website, informationmanagers.ca, for more information about the course. The course starts in January, and you can purchase the course starting on December 8th. That's next week. And we have early bird registration pricing that you can make use of. So I want to pause for the moment and ask you what your questions are and how we can help you with your privacy impact assessment questions. So we do have some bonuses for you for joining live. So when you've registered, you've provided us your email address, and we'll send you a copy of the mind map of those 5 steps for a privacy impact assessment. I'm also going to send you some key steps and some suggestions or a template to help you schedule those key steps in place. Now, when do you start a privacy impact assessment? You can start your policies and procedures and your project description early in the process, but you're not going to complete your privacy impact assessment until you have key documents in place, that you've signed agreements with vendors, that you have made decisions about technology that's going to support that organization. So if you're going to start a brand new clinic, you probably want to start the privacy impact assessment probably 3 months before you start that clinic. You should have made a decision or have a really strong feeling about which EMR vendor you're going to select to work with. And that 3-month time frame is going to help you implement those policies and procedures, write those policies and procedures, and get those contracts in place. The PIA process takes time, so don't shortchange yourself on the amount of time that it's going to take. And you're going to need someone who is going to be the key person to help you with the writing of those documents. Your policies and procedures become that foundation of those steps. You want to be able to review those. Now, if you've done a privacy impact assessment previously, it's a good practice to review your policies and procedures on a regular basis, on an annual basis, or at least every 2 years. Document when you have reviewed your policy and procedure. So I like to say that, yes, we have no bananas. You've reviewed the policy and procedure, and there's no changes to it. It's still valid and current. Do document and update it to say that, yes, that authorized person has reviewed those policies and procedures and there are no changes. So yes, we have no bananas. You want to be able to review and update those policies and procedures on a regular basis. When do you need to send an amendment to the Commissioner's office? You're going to send an amendment as needed. So if you're changing your technology, you're going to send the amendment before you implement that change in technology. So you need to understand what you plan to implement and what are those key factors that you want to put into place. Sometimes you just need to send an amendment every now and again if you're changing your privacy officer. If you've got new physicians or healthcare providers coming to your practice and you need to make sure that they understand your policies and procedures and that they agree to the requirements of the privacy impact assessment, you're going to send a little letter to the Commissioner's office to let them know that you've done that and that they've signed off on those agreements. I want to let you know about an additional webinar that we're holding on December 8th that's going to get into some more details about the e-course. So it's a preview for the e-course about how to do a privacy impact assessment that gets started in January. So if you'd like to join us for December 8th, you can take a look on our homepage for informationmanagers.ca about how you can register for that course. And you can enter your information in the chat box. We'll give you the registration information from there. So the e-course starts open for purchase on December 8th, and we have some great bonuses, including access to Corridor Interactive, The Privacy Awareness online course is a bonus for those people that have registered early for the e-course for Privacy Impact Assessment. That's a course that I wrote with Corridor Interactive, and they now have the technology to be able to provide that online in a great interactive format. So when you purchase the e-course on the early bird registration, you get access to that bonus for the Privacy Awareness course. The Privacy Awareness course is a one-user subscription, and you have access to that course for 3 months. So you don't have to use it right away, but sign up and for the early registration for the course, and you will have access to it. If doing a privacy impact assessment is new for you, I strongly recommend that you take the course for the privacy awareness training. That will help you with the privacy impact assessment course as well. If you do not have a standard consistent training for your practice yet, definitely take a look at the course with Corridor Interactive. Online training can be a solution for many folks. Sometimes you also want to be able to have somebody in person to help you with those privacy awareness requirements, and you can hire us with information managers to come to your organization to help you with that training process. So we're going to wrap up our webinar today. I'm delighted that you've had the opportunity to join us and to talk about the privacy impact assessments. Let's stay connected. We're here just about every Thursday with a live interview with many different guests and experts. Interviews are available on replay for a limited time. You can join us as a member of Information Managers Network and have access to all of the great interviews with our guests at any time that fits your schedule. This is Jean Eaton, the Practice Management Mentor and your Practical Privacy Coach with Information Managers. It's been great to have you with us, and I look forward to seeing you again. Stay tuned.